Thanks, Mike. It's now 7:11, and it's the story making headlines across the sports world. Late Bengal Chris Henry suffering from a degenerative brain damage before his fatal accident. Coming up on Fox 45 in the morning, we sit down with a local neurologist to weigh in on the recent findings.
Just about 7:15 now. Well, back in December, Bengals wide receiver Chris Henry died in a tragic accident involving blunt force trauma to the head. But yesterday, doctors announced that Henry suffered from chronic traumatic encephalopathy. It's a form of degenerative brain damage. Go figure, I make it through encephalopathy and have trouble with degenerative. But apparently it was caused by multiple hits to the head. Now, Dr. Timothy Schoonover is a neurologist from the Kettering Health Network. He joins us this morning to talk more about this form of degenerative brain damage and how it could have played a role in Chris Henry's life. Doctor, thanks for joining us this morning.
It's my pleasure.
So first, when it comes to this form of traumatic encephalopathy, obviously a big word there for this condition, how can people basically come about having this condition?
Well, this looks like a condition that occurs after multiple blows to the head. They do not necessarily have to be severe blows with unconsciousness or even full concussions, but just repetitive blows appears to cause this.
Okay, because I know it has been documented that Chris Henry did suffer numerous concussions throughout his football career. I mean, even back as far back as high school, but you said you don't necessarily have to have a concussion for this to occur.
That's correct. As long as the blows are multiple and over a period of time, it appears to be the trigger.
And what are some of the effects of this? Would it be called a disease or just sort of an effect?
Well, I believe it's a disease. A trigger may be the trauma, but then the process occurs. There are changes in the brain that can cause mental changes similar to dementia, such as Alzheimer's, with behavioral changes, memory problems, emotional instability, and those types of problems.
I know it was well documented, obviously, with the legal trouble that Chris Henry had, and obviously this would be purely speculative at this point, but it seemed like there were a lot of people that were close to him that said he did seem to change when he was going through all these different things in the NFL, when he would go through being arrested, being suspended. Do you think it's possible that these changes in behavior then could be attributed to this?
Well, I believe it's possible. It's hard to say for sure. As you said, it is speculative. There may have been some pre-morbid personality issues that resulted in part of this, but it certainly can be possible. Some of the behaviors they had could be due to this.
Now, does it take a certain amount of time then from repeated injuries to the head or blows to the head, or could this happen maybe just after one traumatic instance?
It appears this is a time issue.
Okay.
One traumatic instance is not likely to cause enough injury or enough microscopic changes to result in this clinical syndrome.
Okay. Now, would this also make you prone for maybe other disorders of the brain as well, if you encounter numerous blows to the head?
It appears that it does, especially dementia that we've talked about. Even some Parkinsonism or Parkinson's disease-like processes may occur from these kind of injuries, yes.
All right. And then obviously, just very quickly here, I mean, obviously a lot of kids getting ready to train for football this summer and things like that. What are some precautions they could take other than obviously wearing a helmet?
Obviously wearing a helmet and in following your coach's directions. And if there is a head injury, even if it's mild, sit out, make sure you're completely recovered before you go back in and start taking more hits.
Okay. Well, Dr. Schoonover, thank you so much for coming on this morning. I know we had a brief amount of time here to talk about this, but we appreciate it.
It was my pleasure.
All right, it's 7:18.